So it looks like a lot of our registrants, our attendees are joining the session. So I'm going to introduce this session in just one more minute, allowing those other registrants who aren't here yet to all be in the room with us. So all of you who are joining us are here to take part in the May version of Booster Sessions. And I'm just going to say good afternoon and welcome to the May edition of the Staff Wellness and Health Booster Sessions. We're excited to present today's session on accessibility. My name is Kate Evans. I am with Shared Health and I'm going to be moderating this session. So if anyone has a comment or a question, please feel free to put that into the question box or the chat, whichever comes up first. Dana is here moderating with me and we will be putting your questions, allowing them to be shared to Gail when she's finished her presentation. So thanks everyone for joining us for today's overview of the Accessibility Act for Manitobans and how it supports employees with disabilities. The Act consists of 5 standard building blocks for making real, measurable, and effective changes to accessibility. Each standard outlines specific requirements and timelines for organizations that have a responsibility to comply with the Accessibility for Manitobans Act. Our presenter today, Gail Hrishko, is the Manager of Organizational Projects for Shared Health. And prior to this, Gail spent many years with the WRHA's Occupational and Environmental Safety and Health, otherwise known as OESH, O-E-S-H. Gail was developing and managing their disability management program, as well as the Provincial Healthcare Violence Prevention Program. Before we get to the presentation, I want to note that we will have a few minutes for questions once Gail is finished presenting. So if any questions come to your mind during this presentation, please enter them into the question section. Also, today's session is being recorded and will be made available as a streaming video on demand on the health provider's website under mental health and addictions. And with that, I will turn things over to you, Gail. And again, everyone who has a question, please enter it while Gail's presenting. Thanks for being with us today, Gail.
Okay, thank you very much. All right, so just to give you a bit of an idea of what I will cover today, we're going to talk a little bit about the Act and a brief overview of the standards. We're also going to look at how this ties into the Manitoba Human Rights Code and the obligation of employers and organizations to provide accommodations. How this is affecting you as an employee with an accessibility barrier or challenge, and just a link to some resources at the end. So right on the screen, we have the mission and vision for the Accessibility Act of Manitobans. And overall, the intent is really about providing greater accessibility and inclusion for Manitobans who experience disabilities or issues accessing services throughout our system, and for us specifically in the healthcare system. And it gives us a bit of a roadmap to start to follow to become a more inclusive Manitoba, where we are considering that everybody is differently abled and valuing that diversity and independence in consideration of the human rights code that we all follow as well. So the Act came into being in December of 2013. And the legislation and its accompanying standards really provide the roadmap or the process to begin dismantling barriers. So applying primarily to people with disabilities, as well as many other citizens who would experience similar challenges. And the Manitoba government is committed to moving this process forward and getting to full compliance with all the organizations to whom this legislation is applicable to. And it's done through a process of incorporating the feedback from organizations, disability groups, public and private sector. So now we're going to just briefly go over the 5 standards that are part of the Act and talk about which ones apply to healthcare. So the first one is the standard for customer service, and this has been in place for a number of years. Many of you may be familiar with a training module that is offered through the learning management system on how to provide an accessible customer service for people. The second standard that has also been in place for a number of years is the one for employment, and I'm going to come back to this one in a moment just because this is the basis of today's talk. The third standard, which just came into effect on May 1 of this year, is information and communication. So how to provide information in a web format or other means of communicating with persons who may use different types of assistive technology for that purpose, making sure that we are informing the public of the ability to offer information in different formats to them. The fourth standard is on public transportation, and we have been having some discussion with the Manitoba Accessibility Office as well as the compliance standard just to clarify whether or not this standard does apply to healthcare. Because it is referencing public transportation like buses and taxis, this is not a service that we provide in our health system, so the standard is felt not to apply to us. Now, that being said, the standards can change over time, so we continually review any changes that come in to determine if we have to make some changes to that. And then the last standard is for the design of outdoor public places or spaces. This one continues to be in consultation and development, and we're not sure what all is coming out in that regard. So back to number 2, for employment, this standard is requiring that we make sure that we're implementing practices that support hiring of persons with accessibility challenges or disabilities, as well as providing supports to our employees who may be experiencing any type of barrier to employment. And it ties very closely to the Manitoba Human Rights Code, which requires that organizations or employers provide reasonable accommodation to people with disabilities. And primarily under this code, we're looking at physical or mental disability for the purposes of today's presentation, and the failure to do so can be considered discrimination. Now, the obligation under the Human Rights Code is that we make efforts at reasonable accommodation up until the point of undue hardship. And undue hardship is really a fluid concept that looks at how reasonable is it to make changes to the workplace or the duties of the person who requires the accommodation. So sometimes such changes can become so difficult that it becomes unreasonable to be able to do them. And some of the factors that get considered in that equation is financial costs, health and safety concerns, the impact on other employees or service users, and the impact on other protected rights under the Human Rights Code. So for example, a very small we'll call it a little mom and pop store on 2 floors, and a person requires a means to get to the second floor where their job is. It may be unreasonable for an organization of that size to be able to install an elevator in that building, but they may be required to look at other ways to do that. So similarly in healthcare, we're looking at how can we reasonably accommodate up until the point of undue hardship. And again, it must be based on facts, not assumptions. So we're required to show due diligence that we have looked at all options to accommodate a person with a disability. So how does this start to look in the workplace? Injury, illness, or accessibility challenges, when they impact your ability to carry out your job duties or attend work regularly and consistently, your employer, Shared Health, or whoever you're working for in the health system is obligated to inquire about the nature of that condition, and determine ways to provide a reasonable accommodation for you. Now, I understand from our host today that we've got people from different parts of Manitoba or Winnipeg in on this presentation. So I'm just going to speak very high level to the process that they may differ from site to site or region to region, but it usually starts by the employee, in this case, identifying to a manager or supervisor that they're experiencing a health issue that's impacting their ability to carry out their job. And so this could happen through a manager directly if you have an occupational health and safety department or a human resources department. So what does this mean for you as an employee, and how does this happen? So typically what will occur is that you will be asked to provide medical documentation identifying that there is a disabling condition or a barrier to accessibility in the workplace, that it does exist. It asks for identification of what the restriction on your work duty is or what the barrier might be. And if there are restrictions, how long they are in place for. And this process typically does not require a diagnosis or disclosure of the exact nature of what your medical condition would be, just an understanding of what the issues are that are creating a challenge for you to perform your work duties. And in some locations, a disability manager will be assigned to review the request for an accommodation, and then works jointly with you and manager, supervisor, union representatives where they exist to develop a plan about how to provide an accommodation for you. And throughout this process, you might be asked to provide additional medical information from your healthcare provider at certain intervals if it's required. And an example of this would be, very on, say, following an injury. Maybe you've broken your leg and you may be very limited right after your injury, but able to do some work. And as you start to recover and heal, the restrictions on your work duties will become less and less, and allowing you to perform more and more of your regular job. So that's when an update is requested from your healthcare provider so that the planning can continue to support you getting back to your full job. And because this process can be a little bit different everywhere, if you want to know more, I would suggest reaching out to your health and safety department if you have one in your workplace, or your human resources department. So what does this mean for our wellness in the workplace for healthcare workers? The reality is that injury or illness or disability can impact any of us at any point in time throughout our working lives, whether it's a condition that you're born with, a work-related injury, or just an illness that develops over time. This can all impact our ability to be productive in the workplace and continue to do your job. And we know that work is an important part of daily life, and it really is critical for providing routine and structure and the ability to connect socially with the people that you work with. And for many, it's that ability to earn an income and support yourself and your families that's very critical, and can be a great source of worry for staff when they do become injured and wonder, what's going to happen to them. So we incorporate this into planning return to work and try and foster people coming back to work as soon as possible, even while they're recovering from the injury, because we know that it generally helps to improve outcomes for people. So it's a bit of a balance in terms of looking at how ready you are to rejoin the workplace and making sure that we have a plan in place that will support you throughout that transition back to work. And the other part where it becomes very important as you continue your career in the system, your abilities may change even by virtue of age. So it allows you to stay as productive as possible throughout the length of your career. And we also support offering accommodations to people that apply for positions within the health system by letting them know upfront that they can reach out if they need any type of accommodation throughout the interview or the application process. So you can find out more information about the Manitoba Accessibility Act here, as well as the Human Rights Code, just if you're looking for more information. I didn't include specific links within the health system just because our audience is quite broad and I didn't know that I would be able to fit them all in. But that concludes just the information part of this. So I will certainly take any questions that people have.
Thank you so much, Gail. I'm not seeing any questions in the question box just yet, but I'm curious to know if there were some other resources that you think might be specifically worth checking out to know a little bit more and understand a little bit more about accommodating or even exploring accessibility in the workplace.
Yes, so you can certainly look on your employer's website, and there may be different sections of information in relation to that. If you're not sure where to find that, you can reach out to a manager, supervisor, or human resources to possibly point you in the right direction. If you are a unionized employee and have questions about it, that's another good place for you to reach out with your questions, and they can help connect you up with the appropriate process for your workplace.
Awesome. Thank you so much, Gail. And I'm not sure if you're aware, your screen is being shared right now, so we're able to see your inbox. So maybe if you want to just stop sharing your screen, and then we'll just enjoy seeing you for any other questions that might be coming in. Perfect. Thank you so much. All right. Well, perhaps you've satisfied everyone's curiosity completely with your presentation. I'll just ask you, Gail, if there's anything you'd like to mention in addition to all the information you've presented, any highlights or any comments to make sure folks know about before we wrap the session up.
Sure. One thing I can mention is that I spoke earlier about how we're not asking for a medical diagnosis when you do identify that you have a health condition. Just understand that when we work with, your manager or supervisor or union, the conversation is really about restrictions and abilities and trying to determine from that information about what tasks you can perform in the workplace as opposed to what your health condition is. So that's oftentimes a concern for people, that information is going to be shared.
Right. Okay, well, thank you so much. Thank you to everyone who's joined us today. Just to remind folks that this will be housed on the website and we rebroadcasted on Friday, May 10th at 3 p.m., Sunday, May 12th at 8 p.m., and Tuesday, May 14th at 12 p.m. And with that, I want to say thank you, especially to you, Gail, for your terrific presentation. Know that we are in the planning stages for the June session, and those details will be shared through our usual channels and also on our page on the health provider's website. Again, thanks so much to you, Gail, for your presentation, and to everyone who attended. Have a great day.
Thank you, everyone.
All right, take care. Bye-bye.